Hello, I'm Dr. Sarah Wasserbauer, and here's the question. What can I do to protect myself against COVID-19? Well, there's a couple of questions that come to mind immediately that a lot of my patients have been asking. You see a lot of people around wearing masks, a lot of people around wearing gloves. So I've gotten the question, should I use masks or gloves? Let me answer that for you. Kind of depends on what you're in particular trying to do. So if you're trying to keep yourself safe, then the number one thing you need to be is a hand Nazi, and I'll talk about this in another little video. But if you are trying to keep your germs to yourself, the mask is not really what's going to do that. The gloves are going to do that because a lot of this is transmitted by handshakes, touching a surface. Somebody else comes along, touches the same surface, and they pick it up. It doesn't infect you from your hands, though. The only way it infects you is actually when your hands then touch your face. People do this all the time. I've been graduated from medical school for 20 years, and they taught us this in medical school. And gosh darn it, if I don't still touch my face at all times. I mean, you just catch yourself doing it. You rub your nose, you rub your eye, you touch, any little thing. You're always touching your face. And this, and this are the mucous membranes, like the inside of your mouth, the inside of your nose, the inside of your eye. That's where COVID-19 is going to get in. That's where any virus is going to get in. So gloves are going to keep your viruses to yourself, but the mask is actually going to prevent you from transmitting it to yourself. It's going to give you a chance to get somewhere after you've been to the grocery store and wash your hands. Most of the masks that are going to keep everybody else's air droplets, their coughs, their sneezes, all the other stuff that is aerosolizing this virus is going to keep that stuff out. We're giving those to the medical practitioners who are on the front lines, the people who are in the ERs, who are doing the drive-through clinics for testing, who are, in the ICU. That personal protective equipment is not necessary for you and me, but it does help you to realize, oh my gosh, I'm going to be touching my face at all times. Now, you don't have to wear a pair of glasses. Some pair of sunglasses will do. You just got to remind yourself not to, rub your eye. And make sure that if you get sick, then you self-isolate. But if you're going to pick between gloves and a mask, let's say you're going to the grocery store, maybe you pick the mask, actually, even if you're not feeling sick. Because remember, you could have COVID-19 and be transmitting it to other people for 2 to 3 days before you notice that you've got some symptoms. So if you're in that kind of questionable territory where you're like, well, I just want to make sure I'm not transmitting it to anybody else, then wear the gloves as well. But for just going around and getting your regular stuff done, remind yourself not to touch your face by wearing a mask. I hope that helps.